Hey guys, this is Austin Phillips with Procell Therapies, one of the international trainers, and we're here at the beautiful Leucadia in South Tampa. Today we're going to be talking about doing a hair treatment. So hair treatments are something that have been increasingly popular with Procell over the last couple of years, especially since COVID hair loss came and took reins. So essentially when it comes to hair growth and hair loss in general, in one way or another things are tied to essentially a loss of circulation. So if we were to stop, say, eating food and drinking water for a week, a lot of us would become emaciated, we'd become thinner and thinner, and eventually we would perish. Well, your hair follicles work very similarly. If circulation in the scalp stops, basically your follicles become thinner and thinner, the hair becomes thinner and thinner, and eventually recedes beneath the hairline to where we're at the alopecia stage. So Procell microchanneling is amazing for hair growth in the applications of age-induced conditions, stress-induced, it could be alopecia, genetics, and pattern baldness, all ages in both male and female applicants. So today we have Tally Graves with us, and for him we're actually treating some pattern baldness up through the scalp. This will actually be his third treatment. So basically if we had where we started to where we're at now, we're seeing a lot of new follicle generation. We're starting to see some color coming through with the horseshoe, and we've been actually able to see a lot of new consistent growth throughout the top and receding area. So with this one, this will be a continuation. The follow-up treatments are every 2 weeks, and of course we have him on the reoccurring Procell aftercare for that hair treatment. So to begin with the treatment, it will begin just like our other ones, so we'll disinfect with the alcohol pad. And Tally had already come in with his hair washed, so you definitely don't want to be trying to remove gels or anything like that before your application, as of course you don't want to needle anything foreign into the scalp. That will definitely cause some irritation here. So we'll go ahead and cleanse the scalp. And we want to make sure to get in the areas where that hair is just starting to match as well. So for Tally, this is a very easy scalp to treat, and what you'll see is because there's not going to involve a lot of the separation and the parting that you would see with typical scalp hairline or spot treating. So normally with the treatment, you'll be separating the hair with a stainless steel comb for sterilization. To separate the area, you'll stamp where you had just parted that area, and then introduce your serum. You'll part another 1/4 of an inch, stamp throughout that line, and introduce serum from one side of the scalp to the other until the area is treated. Typically also when you're treating for volume, or especially with female clients that have a full head of hair, utilizing the stainless steel banana clips are going to be ideal to help hold that hair in place while you're making your needling pass. For the scalp, it is imperative to use at least a depth of 0.5. And the reason we need to be at 0.5 is because we need to stimulate the stem cell sacs at the base of the follicle in order to get that blood and oxygen and nutrients to start nourishing the scalp. From there, that will be the first part that was missing. You know, a lack of circulation in the scalp leads to that hair loss to begin with. Creating this micro-injury is going to rush those oxygen and nutrients to that area. That in combination with our stem cell derivative, this is going to contain growth factors and cytokines that are going to help naturally mimic dermal papilla function, leading to natural hair growth for the applications that we just discussed. So without further ado, we'll go ahead and open this sterile tip. So from the same perforated edge, we'll push that out into the corner. Pop our tip out the side. To attach the tip again, this will be directly roll it on over top, and you'll uncap to expose that 0.5 depth. For Tally's scalp, since you see that we're treating the entire horseshoe region and not just spot treating, we're actually going to use 2 serums to ensure that we can cover the entire surface area and saturate those follicles to the best of our ability. Just like in our past treatment, you saw how we rehydrated the skin just slightly since we disinfected with that alcohol. So we'll apply just a little bit of serum to the area to assist with that discomfort. For the scalp treatments, although we're also at a 0.5 depth, normally at that depth I'd recommend some numbing. Being that we're treating the scalp, we don't want to use numbing because lidocaine is a vasoconstrictor. Constricting those blood vessels is going to also restrict that hair from being able to get the oxygen and nutrients it needed. So do not use lidocaine on the scalp when treating. We'll operate with the device on the high setting. Weight of the motor is going to stay on top of the hand. And Tally, angle your head just slightly over here. So we'll begin again right through the top. 5 stamps and a 50% overlap. So that will be our first little section. Go ahead and take advantage of those open channels that we just created. We'll rehydrate and outline the next area. We're treating the scalp for just about any condition that's coming through the door involving loss. A number of treatments is going to be important. So hair grows in a cycle of 6 months. So it's going to be imperative for clients to do a minimum of 5 treatments, especially since treatments are only every 2 weeks. So a total of 5 or 6 treatments will be a 90-day reversal. Where Tally's at right now, again, this is treatment number 3. So we're at 1.5 months and are currently already seeing a result in his scalp generation. In combination with the treatments, what we'll also have Tally on is our typical scalp hair aftercare. For the hair aftercare, he will not use the aftercare for the first 3 days post-treatment due to sensitivity of the scalp. He will use that for the next 6 days and will discontinue 3 days before the next treatment. So they'll use that in between each series of treatments to maximize the result and also preserve the results once our desired area has been treated.